Aloha Kauai, here's our COVID-19 briefing from Team Kauai for Wednesday, February 10th. The Department of Health is reporting no new cases today. We currently have one active case in isolation. None are hospitalized. We have one person in health-directed quarantine as a close contact. Our cumulative case count is now 210, including 179 confirmed locally, one probable, and 30 tested elsewhere but reported after arrival on island. More than 16,000 doses of vaccine have been administered on Kauai. Many of those in phases 1A and 1B are receiving second doses. We are also providing mobile clinics for homebound residents who are eligible. We expect to move into phase 1C as soon as vaccine supply allows. This will expand the eligible group to include residents aged 65 to 74, residents 16 to 64 with high-risk health conditions, and all other essential workers not already eligible. The more people who are vaccinated on our island, the better we can protect ourselves from the spread of COVID-19. But we understand that the information out there about vaccines can be confusing and overwhelming. Today, we welcome our Kauai District Health Officer, Dr. Janet Behrman, to help us understand what we need to know about vaccines.
Thank you, Mayor. As we expand the availability of COVID-19 vaccines in our community, we're aware that some residents are hesitant about getting the shots. I wanted to share my thoughts as a public health physician and a pediatrician. Receiving any vaccine is a personal decision. Just as choosing the vaccine carries certain risks, choosing not to be vaccinated also carries risks. Neither choice is a no-risk option. In my view as a physician and as a mother, the benefits of vaccination, with few exceptions, outweigh the risks. We know a good deal about the COVID-19 disease and about the two available vaccines, and we're learning more with each passing week. COVID-19 illness can be severe, even in young and otherwise healthy people. 1 to 2 in 100 cases are fatal. 7 to 10 in 100 cases require hospitalization. Some people suffer long-term or even permanent effects. We know the disease is worldwide, and it appears to be here to stay. We know that both the Pfizer and Moderna vaccines are highly effective. Now that tens of millions of doses have been given, we know a lot about their safety. Common effects of the vaccine include soreness in the arm where the vaccine was administered. Many people experience some level of fatigue, fever, and body aches after vaccination. These are an indication that the body's immune system is reacting to the vaccine, that the body is forming immunity, and this is what a vaccine should do. A very small proportion of people, 10 or 11 in a million doses of vaccine, will have significant allergic reactions to the vaccine. These symptoms develop within the first half hour or so after receiving the vaccine. We take precautions to ensure that vaccines can be given safely. Everyone must be observed at the vaccination site for 15 minutes after receiving the vaccine. Doctors and nurses monitor the observation site and have training and supplies to provide emergency medical support for allergic reactions. People with a history of certain kinds of allergies will be monitored for 30 minutes rather than 15. And people who have had severe allergic reaction to any injected medication may not receive the vaccine. History of such a reaction is a contraindication to being vaccinated. Understandably, many people have concerns about receiving a new vaccine, just as many are fearful of contracting this new virus. So we each need to decide which way the balance of these concerns tips for us. It's a personal decision. People can find accurate information at the Hawaii Department of Health and CDC websites and can discuss their concerns with their healthcare provider or with someone from the Department of Health. Here are some key points. Evidence is mounting that the vaccine not only protects the person who is vaccinated, but also prevents accidental spread to others. So some of us will want to be vaccinated to protect our loved ones, even if not for ourselves. Having a high percentage of our population vaccinated is our clearest path to more normal lives, to being able to travel more freely, work and socialize with fewer restrictions, welcome visitors back to our island, and revitalize our local economy. comparing the risks, keep in mind that about 10 people in 100 who get the disease must be hospitalized, but only roughly 10 people in 1,000,000 have severe allergic reactions to the vaccination. We are seeing that as more and more people get vaccinated, more of us feel comfortable making that choice for ourselves. We see that our friends, families, and colleagues do well with the vaccine, and we see the relief they feel, the peace of mind they gain in knowing that they have this added level of protection. The more we learn about both the disease and the vaccines, the clearer the balance is, in my opinion, on the side of being vaccinated. Mahalo.
Thank you, Dr. Berriman. We are moving more quickly with vaccine rollout than most of the nation, partly because of our low disease incidence rate on Kauai. It allows us to focus our Department of Health resources on our vaccination clinics. We'd like to take this opportunity to extend our gratitude to our Kauai District Health Office, our hospital and pharmacy partners, and Ho'ola Lahui for hosting vaccine distributions. Mahalo to the Medical Reserve Corps and our KCC nursing program for volunteering your time to administer vaccines. And to our Kauai Incident Management Team, our staff from the Parks and Recreation Department, the Office of Elderly Affairs, and our firefighters for helping us to run a smooth operation at our vaccine pod or point of dispensing at the convention hall. We are well positioned to ramp up our vaccine clinics as soon as vaccine supply increases. For additional information on Kauai's vaccine program, please visit kauai.gov/vaccine. Mahalo for understanding the role you play in mitigating the spread of COVID-19 on our island. Please continue to wear your masks, wash your hands, keep your distance, and avoid large gatherings. Together, we can help to keep Kauai safe.